Many people face health challenges as a result of nutritional deficiencies. You may even be one of them. A lot of doctors don't identify these deficiencies, and as a result, the symptoms continue to get worse and the health condition remains. Hey Wellness Warriors, I'm Dr. Nick Zyrowski, and I started my holistic health practice in order to help you take control of your health naturally, because true health only comes naturally. So be sure to subscribe to the channel, hit that notification bell, and give this video a thumbs up, and share with me your thoughts in the comment section below. Also, we are in open enrollment for NutriCore. And NutriCore is a natural health service that uses science-based lab testing in order to identify your health challenges with pinpoint accuracy. Once we identify the problems that you're facing, we put together a roadmap in order to help you reverse them. And you heard that right. We look to get to the root cause and fix the problem, not cover them up with medication. There's countless 5-star reviews and incredible transformations that you can read about. What I'll do is I'll put a link in the description below so that you can learn more on how you can take control of your health in 2021 using a natural healthcare service. I had a patient that started developing a lot of pain and also floaters in their right eye. If you've ever had floaters in your field of vision, it's incredibly annoying. Now, when they went to their doctor thought to themselves, well, maybe this person has glaucoma. Maybe they have optic neuritis. Maybe they have dry eye syndrome. Or maybe this person's getting migraines. The patient was told pretty much everything it could possibly be, and then they were sent home with eye drops. The problem was that this left them with no answers and still facing the same problem that they originally saw the doctor over. Now, because this patient was also working with me, I took a holistic approach to the situation. And based off their health history, what I did is ran a few tests, and one of the things that I looked at was their vitamin stores in their body. And so I wanted to see if they had a vitamin deficiency. And lo and behold, when we got the test back, I found that they had a vitamin A deficiency. So I gave them a clinically relevant dose of vitamin A according to their situation, and within 2 weeks, the eye pain and the floaters were completely gone. He seemed to get sick more often. Seasonal flu, bacterial infections. He seemed to get everything that passed by. After we boosted up his vitamin A stores and worked on the deficiency, all of a sudden, he wasn't getting sick as much. Well, it turns out that vitamin A was pretty important for his immune system health. And a lot of people say that you are what you eat, but the fact is you are what you absorb. In this particular individual's case, he had a gut condition that was not allowing him to absorb the vitamin A that he was consuming. And a lot of health conditions aren't what they seem. In this particular case, you can see how we went from gut condition to vitamin A deficiency to eye pain, and all the doctor wanted to treat was the eye pain. And the reason that this case is so relevant and important to you is because most doctors like to just keep throwing pharmaceuticals at situations like this, but never get to the root cause. It's an absolute travesty in our current healthcare system, so don't get caught in that trap. It's estimated that 1/3 of Americans have a vitamin deficiency. A huge one that I see is going to be a vitamin D deficiency. Now, if you have a vitamin D deficiency, your body cannot express true health. It's incredibly important for immune health, hormone health, cardiovascular health, and the list goes on. In this current viral situation that we're dealing with, vitamin D is incredibly important. There was one paper that found that the majority of hospitalizations and deaths were correlated with a lack of vitamin D in the body. And I'd say probably about 40% of the people that I test personally have a vitamin D deficiency. But here's the good news of this whole situation is that vitamin D is very inexpensive to test for, and it's very easy to supplement with a vitamin D supplement as well. Magnesium comes next on one of the top deficiencies we have to look out for. It's estimated that 50% of Americans do not get their daily recommended allowance of magnesium, and it's highly, highly underrated. That's because magnesium is important for sleep, it's important for your mental health, it's also very important for your digestion. And what a lot of studies show is that as magnesium goes down in the body, if you have a deficiency, what they're showing in the studies is that your risk of cardiovascular disease goes way up. And statistically, when we look at cardiovascular disease, it's up there as one of the top killers, so we have to be very aware of that. I personally supplement with magnesium daily. I think it's something that I need, and it may be something that you need as well. The next deficiency is one that I feel a lot of people are familiar with. I ask patients all the time, what vitamins are you taking? And they list this particular vitamin, and they don't even know why they're taking it. This is vitamin B12. It's incredibly important for the body, and it's estimated that 15% of people have a deficiency in it. Vitamin B12 plays a role in your DNA. If you have a deficiency, deficiency, it can alter brain function, it can cause fatigue, it can elevate homocysteine levels in the body, which would increase your risk factor for many different diseases. It also can cause weight loss issues, constipation issues as well. Now, one of the major reasons that I find that people have a B12 deficiency is because they have very low stomach acid. You have to be consuming B12 through your food in order to have it in your body, but you also have to have the proper environment in your stomach in order to actually break it down. So low stomach acid is a major issue that many people face, and B12 is a deficiency that comes after that. Understand too that B vitamins in general are incredibly important. I find that a lot of people have B6 deficiencies and B1 deficiencies, and I think it's a lot to do with just living in a high stress environment, and just a lot of people are unhealthier than ever before. Now, the next deficiency we're going to talk about is a mineral, and I feel like this is one that many people have also heard about. That is calcium. Now, calcium is incredibly important in the body, and there was a study that looked at 16,000 individuals, and of those 16,000 individuals, 39% of them had a calcium deficiency. Calcium is incredibly important for regulating proper muscular function, nerve function, and also even your hormone health. As you have decreased amount of calcium in the body, what happens is it starts to rob from your bones. So this is where you start to get issues with like weak teeth. You start to get issues with osteoporosis. And especially as you age, this becomes even more and more important. So make sure that your calcium levels are on point. Another major deficiency that affects mostly women, but also can affect men, is going to be a deficiency in iron. And so we don't want this to happen. And that's why as you hear of all these different deficiencies I'm talking about, it's always good to take a good broad spectrum multivitamin because it just covers all the bases. What I'll do is I'll put a link in the description below to the one that I take personally. And as we look at all these vitamin deficiencies, there's many reasons as to why they can happen. They all have a complicated backstory, but there's a few commonalities in which we can break down as to why you may be having a vitamin deficiency. One is going to be pharmaceuticals. As you take pharmaceuticals, it just strips your body of its natural nutrient stores. This is why many of the elderly are very vitamin deficient, because they're on a lot of meds. Now, another major reason is going to be due to a poor quality diet or a lack of diversity within your diet. Are you eating lots of leafy greens? And then lastly, and a huge reason, is due to poor colon health. As I said before, you aren't what you eat, you are what you absorb. And if you have poor colon health, unfortunately, you're probably not absorbing your food very well. To start eating the most nutrient-dense foods on the planet, watch this video right here where I uncover the top foods that you should eat daily. Now, when we eat kale, you can even mix it with some healthy fats and really have a superfood powerhouse. And you do this by simply sauteing it with some coconut oil.